Feeding a baby isn't complicated, but the sources of food for an infant are limited, which increases the risk of poor nutrition. Also, there are several risk factors that can lead to a calcium deficiency in your baby, ranging from genetics to medication. If you aren't breastfeeding your baby, one of the health concerns that you need to watch out is a calcium deficiency. Find out what calcium deficiency is, how it can affect your baby, and what is the way forward. Why is calcium important for infants? Normal calcium levels are essential for the heart and muscles to work properly, as well as to ensure bone development. As your baby will grow rapidly, calcium plays a vital role in his overall bone strength. This mineral is essential to people at all stages of development and life, but it is especially critical for babies. It is worth knowing that the success of your baby's bone development will affect her for the rest of her life. In addition to this, calcium also helps in proper muscle function, heart function, and nerve impulse transmission. Clearly, it is vital to ensure that your baby is getting enough calcium. Causes of calcium deficiency in infants include medications that may decrease calcium absorption, poor supply of oxygen during the delivery of the baby. Poor exposure of your child to sunlight can lead to a deficiency of vitamin D. This also reduces calcium levels in your baby, as vitamin D helps in the proper absorption of calcium. A diet that is rich in cow's milk can lead to calcium deficiency. This is primarily due to two reasons. One, the infant's body is unable to absorb the calcium in cow's milk in the first place. Secondly, milk acidifies the body and calcium is drawn from the bones to negate this acidification, leading to loss of calcium. Premature birth. The mother experienced gestational diabetes. Signs of calcium deficiency in babies. Observing the symptoms of calcium deficiency is difficult in infants. Hence, it is important to keep an eye out for some of the signs of calcium deficiency in babies. Here are some of the most common signs that your baby may have a calcium deficiency. A path of sweat forms on the baby's pillow or hair while sleeping. Teeth are slow to come in and may appear loose or uneven when they do grow in. Protrusion of the belly. A lack of interest in his surroundings. Erratic or unpredictable emotional behavior. Poor growth and deformities in the joints, poor level of mental concentration, loss of appetite, difficulty in sleeping at night and crying more than usual as a result of night terrors, suffers from seizures and convulsions due to poor oxygen supply to the brain. Treatment for calcium deficiency in babies. For babies whose calcium deficiency is not so severe, it may be possible to correct the situation with more exposure to sunlight. The extra vitamin D can go a long way towards helping with calcium absorption. It also may be wise for the mom to make another try at breastfeeding if this is at all feasible. Breast milk is loaded with calcium, which is just one more reason why it is called nature's perfect food. For those infants that suffer from seizures, calcium could be directly administered into the bloodstream. However, this method has one major drawback, which is that if it is injected too quickly, it can lead to heart failure. Thank you for watching. Please remember to like and subscribe to help us keep bringing you this everyday knowledge.